I am the chief executive of a hospital. If I were to want my hospital to start working towards accreditation with QHA Trent, how would I begin the process?
You can visit the QHA Trent website, where you are given several options. You will be able to email their team, or you can phone or fax them.
Good day, QHA Trent. Can you explain to me what will happen if my hospital chooses to begin the journey to accreditation with your organization?
Hello, and thank you very much for calling QHA Trent. QHA Trent asks you to sign a Memorandum of Understanding and a Non-Disclosure and Confidentiality Agreement. QHA Trent will then be able to send you a copy of their comprehensive evidence-based standards. They will not charge you for this.
So I don't have to pay for a copy of the standards? That sounds great. What happens next?
QHA Trent will then fix up for an expert to visit your hospital or clinic for what we call a pre-survey.
What do they do at the pre-survey?
The experts that visit will take a preliminary look around your hospital. They are very experienced at spotting problems, and they will discuss any potential problems with you.
Is that all?
Most certainly not. QHA Trent experts will meet with your management and staff, and provide teaching sessions for them.
That sounds a very good service. However, the last time I spoke to a consultancy firm about providing us with help of this type, their fees were very high.
That's not the case with QHA Trent. The fees for our pre-surveys are really good value for money, and they're clearly published on our website. It is the same for all our services.
My goodness. You mean you actually publish all your fees and charges for services openly and transparently? That is very impressive.
Well, as QHA Trent expects hospitals and clinics to adopt and maintain a culture of openness and transparency, QHA Trent itself does its best to live up to those same ideals.
I understand. Okay, now what happens after the pre-survey?
You, your managers and your staff will study the QHA Trent standards closely, and make sure that everything needed to ensure a successful survey outcome is in place.
Can I ask what sort of things?
You need to ensure that the clinical and managerial governance is as good as it possibly can be. For example, you must have an active clinical audit program in place. Also, you must ensure that all the policies and procedures necessary to ensure that your patients are always dealt with in a kind, ethical and effective way are in place.
That is really interesting. I can see how important these things are if we are going to be able to serve our patients in the way that we should.
Yes, you are right. Can I add that QHA Trent thinks it is much better for patients if you and your team are able to choose of your own free will to engage with accreditation.
Do QHA Trent dictate to me and my team when our hospital will be surveyed?
No. We believe there is little point in doing a survey until a hospital is genuinely ready. Otherwise, it is a waste of everyone's time. Instead, we negotiate the dates with you.
That sounds incredibly practical and helpful. It would certainly save my hospital needless expense. Now, can I ask who does the surveys?
Certainly. The survey teams consist of recognized experts, and usually include a doctor and a manager, together with a nurse or another hands-on healthcare professional. During the survey, the team will prepare a detailed report. That report identifies areas of good practice as well as areas meriting attention.
Really? That's interesting. You mean that you won't simply be going on about any problems that your surveyors might notice?
No, we don't believe taking that approach is at all helpful. If something good is being done, it is fair that it should be highlighted. This helps a hospital's morale.
My goodness. That sort of thing would certainly help us with doing our job properly.
I am glad you are so positive about it.
Oh yes, it is very refreshing.
Can I add that the QHA Trent surveyors are empowered to talk to anyone, at any time, and go anywhere. Also, they will always do a nighttime visit.
I can't argue with that. It makes great sense that the hospital should work side by side with the accreditation scheme to ensure our learning experience is optimized. Now, I would like to ask what happens once the survey is over. Do you simply send us the verdict in an email or a letter?
No. Again, QHA Trent does not believe that that way of doing things is in the best interests of patients. We believe that every educational opportunity should be taken. Once the report is completed by the surveyors, it is handed on to QHA Trent's Independent Accreditation Award Panel, who study it. Also, the hospital gets a copy of the report. A date is then agreed for a meeting between the panel and representatives of the hospital. The meeting can be face-to-face or via the internet. The panel and the hospital representatives discuss the findings, and then the panel delivers its verdict. The possible outcomes are full accreditation for 2 years, accreditation subject to conditions which need to be met, or unable to accredit. Obviously, it is preferable if hospitals can ensure in advance that they have done enough work to achieve an outcome of full accreditation. However, given that the credo of QHA Trent is to always seek constant improvement, wherever possible we will try to ensure that hospitals are as well prepared as they can be.
I feel I have to ask why QHA Trent goes for a 2-year survey cycle, rather than longer.
That is because a hospital can very quickly change. For example, if a medical director or a matron leaves, this can change everything, and render a good hospital less good.
And that is not good for patients.
Precisely. We should all be trying to make sure that our hospitals, or clinics, or other healthcare provider organizations, are always focused on the patients and their well-being.
Agreed. By the way, it isn't just hospitals that you work with?
No. We also offer general accreditation services to polyclinics, primary care services, dental clinics and a wide range of other providers of healthcare services.
And your prices for these services are always openly published?
Yes.
Lastly, if I were to have what I might call, for the sake of argument, flagship services that I wanted to draw attention to, can QHA Trent help me?
Definitely. QHA Trent offers a service called Accreditation Plus, which looks in detail at such services. A healthcare provider would have had to have already gone through a basic clinical accreditation either from QHA Trent or a similar scheme. For example, QHA Trent has specialized evidence-based and fully referenced standards for assisted conception IVF services.
That's definitely food for thought. Incidentally, are all your standards fully referenced?
Yes. The internet sources are always given, which makes it much easier for you to check them out.
That is very helpful to know. That is exactly the sort of thing that could ensure that during preparation I save a lot of money by minimizing the need to pay out consultancy fees.
QHA Trent always seeks to be helpful. Now, is there anything else you would like to ask me at the moment? You can always get back in touch with us if you have more questions.
No. I can see from your website that you offer help such as training seminars and mock surveys. I now have quite a lot to think about. I will discuss everything we talked about today with my team, and will get back to you.
That will be fine.
I must say, even at this stage, the idea of working with QHA Trent Accreditation seems to make a great deal of sense. I am very glad that I decided to take a look at what all the clinical accreditation schemes had to offer, before deciding on one. Thank you very much. Goodbye.
Goodbye.